So I shall be talking about MRI in diabetic cardiomyopathy, and we'll look at the basic CMR techniques to assess cardiovascular disease in diabetes. So these are the various sequences that are possible, and we'll look at them one by one. SSFP sequence, which stands for steady state free precession, is the basic bread and butter of cardiac MRI. And these are the different views that we generally take, which is very similar to what is taken in echo. So this is the 4-chamber, the 2-chamber, the short axis, and the LVOT view. And this is used to analyze anatomy, mass, wall motion abnormalities, ventricular function, atrial function, and to look for cardiac remodeling. The T2 STIR technique, STIR stands for fat suppression, and this is a technique which looks for edema. And in ischemia, this is very useful in acute myocardial infarction. It is also a useful technique to look at inflammation like in myocarditis. The late gadolinium enhancement technique, the name describes it all. So it is a technique after injecting gadolinium. And it's called late because we take the image 10 minutes after injecting gadolinium. And contrast accumulates in the dead tissue, like in infarction, and it also accumulates in fibrosis. This is the adenosine stress perfusion technique, which is equivalent to what is done in other imaging. And here adenosine is injected and a T1 weighted sequence is taken, and the ischemic area as seen here in the LAD territory is seen as an area of hypoperfusion. There is also feature tracking techniques to capture strain imaging. And this is an example of strain imaging. Strain can be studied in all 3 planes. So here is an example of the different planes in which one can study strain imaging. So MR spectroscopy is one of the newer techniques that have come up, and here is a case we've done in our center to look for myocardial lipid accumulation. And this tall peak represents the lipid peak. There is another spectroscopy technique which uses phosphorus, and this is looking at the ratio between the phosphocreatinine and ATP. Parametric imaging has come to its own now, and here we look at certain parameters, the native T1, the post-gadolinium T1, the T2, as well as ECV. So what is native T1 study? It studies interstitial fibrosis. Like here, we look at a region of interest and look at the mean value. We compare this mean value, whether it be in T1, T2, or ECV, to the control value. So each center has to establish its own control value for comparison. So the mean as compared to the upper limit of control is what is taken. ECV is a ratio of T1 and is therefore expressed as a percentage. T1 and ECV, they measure, T1 measures characteristics of the entire myocardium, whereas ECV assesses the extracellular space. So here is an example of a LAD territory infarct, which is seen on the delayed hyperenhancement image as a bright area. And this is how it is visualized on T1, T2, as well as post-gadolinium T1. So the T1 image and the post-gadolinium T1 image is utilized to calculate the ECV for which the hematocrit has to be assessed. Here is an example of a RCA and circumflex territory infarct as seen in the different imaging. So native T1 is sensitive to infarcts and scarring and adenosine stress, and native T1 can be used to look at the microcirculation. Elevated ECV is an independent factor of mortality in diabetes, and it can be used as a non-invasive marker to evaluate the severity of diabetic heart disease. So this is a study which shows normal patients, volunteers, and diabetic patients, and so shows that the ECV value is higher in diabetic patients.